more indirect questions. Ask them, for example, have any kids said anything about my bald head? And get that conversation going rather than saying, how was your day? Is anyone saying anything at school? Asking sort of indirectly, is it working out when you go to Auntie Jane's for babysitting after school until Dad gets home from work? Because I want to know how you're feeling and if this is working for you or if we need to do something different. So asking those kinds of questions are more likely to get your kid to open up. You don't want to ask them a yes or no question, because what kids will often try to do is to end the conversation as quickly as they can, and so they'll be like, no, everything's fine. So you want to use open-ended questions and maybe more specific questions. So that can take a little bit of practice. But as far as developmental stages go, I'm going to talk a little bit about kids at different ages and what they need. Now, unfortunately, cancer can strike at any age, and it can strike even when you're a young parent and you have a new baby. On the bone marrow transplant team where I work, there's been quite a few women who've gone straight from the maternity ward to the hospital or to Unit 57 where they come for treatment. Very difficult for the whole family. It makes it hard if you're the person who has cancer because you can't be around your baby. Babies aren't allowed up on Unit 57. So you have to wait for passes or to be able to go downstairs. If you get a pass to even just go into the lobby and see your children because they can't come up to the unit. If the baby has a cold, you may get a pass to go home overnight, but if the baby has a cold, you can't. You can't be around the baby. So most parents find that if they have an infant at home, it's extremely difficult. It's taxing on the parent who's watching the baby and taxing on the person who's away from the baby. And depending on the course of your treatment, you can be away from your child for an extended period of time, and when you come home, they don't recognize you, which can be very painful, or they haven't bonded with you. And if you come home, say when the baby's about 4 or 5 months, when they start to make strange, they may make strange with you, which feels like another dagger in your heart. You've missed all this early time with your baby, and then they act like they're afraid of you. So when you come home and you have a baby who's making strange or not used to you, you have to spend time with that child. You can still form an attachment and bond with your baby and make up for that lost time. It's not hopeless. You haven't missed out on that opportunity to be an important part in your baby's life. But you do have to be somewhat patient and give the baby their space to be able to move slowly, to move in baby steps. And gradually, as you're around the baby and play with the baby, then they will form an attachment to you. But that can also be hard if you're fatigued after your treatment. You still may rely on many, many people to help you with the care and feeding of that baby until you're at a point where you can do that physically. But knowing that even playing with little toys, and even if you can't do the major caregiving, the more time you spend with your infant, eventually you'll form that bond and be part of the family. When you're not there taking care of your baby, another important thing to keep in mind is the routines that need to be established. It can be very difficult to get all the child care in place that you need to with even older children, but for a baby, it's important that you try as much as possible, and this isn't always possible, to limit the number of people that are taking care of your infants so that they can form attachments to them and not feel like they're being passed around from too many people. And whenever possible, again, it's not always possible, to have the caregivers come to your home so that at least they stay in familiar surroundings. So there's as little change and disruption as possible. If you have multiple people pitching in and helping take care of your baby, then everyone should try and agree on sort of the routine or schedule that's being used, because it can be confusing to a baby if people are doing different things. And everyone has their ideas about how to raise babies. One mother-in-law might disagree with the other mother-in-law, but everyone, as much as possible, needs to get on the same page. So those are some of the issues with small infants. Then with preschoolers, they don't completely understand what's going on. They can't understand death. Sickness is a bit of a mystery. They tend to have magical thinking about how people get sick and what happens. They may think their bad behavior has made you go away, or that you don't love them and you don't want to play with them. So they can have all kinds of really strange ideas about why things are happening the way that they are, but they're not able to articulate that to you and tell you exactly why they're worried or upset, or just even missing mommy or daddy and not having them around can be very hard for them. So what you need to do is to either through play, like I mentioned before, the puppets, you can act out scenarios where you kind of reassure them that everybody loves them and everyone thinks they're great, and mommy wishes she could be here with you. You can try and maintain contact as much as possible if you can get them to the phone, talking on the phone when you're in hospital, doing quiet activities with them like reading books or just watching them while they play. Preschoolers love an audience, so you might not be able to do a lot of the active things that a preschooler would need. Other people will have to pitch in for that while you're under treatment, but it's important to use a lot of reassurance with preschoolers that you think they're good, that you love them, everyone loves them. There's lots of people in their life who will take care of them, and again, keeping the numbers of people who look after them to the minimum that you need to get through the day. Babies really need this, but so do preschoolers to a certain extent. They need sort of stable bonds with people who can take care of them, and you want to disrupt or reduce the disruptions as much as possible. So again, if you can, get caregivers to come to your home rather than bringing them from house to house to house. Keeping their routines as normal as possible, keeping them in the play groups or their little friends, keeping their contacts up as much as possible with their little playmates. You want to keep things as normal as possible, keep bedtime routines as normal as possible, getting everyone on the same page. Sometimes what can help with this is just having a care journal where you have a diary of the day's events and what the child's routine is, and have each of the caregivers record in a book what they did with the child, how much they ate, when they took naps, all the things, so that everyone can be on the same page so they know. And also, you won't be on top of any changes unless you get feedback from everybody. So it gets a little complicated. School-age kids, on the other hand, can understand quite a lot more, but they can regress when they're stressed out. So you may see a 6 or 7, maybe even 8-year-old kind of regress to preschool levels and start to have magical thinking again, thinking maybe they caused it. But most school-age kids will understand that they didn't cause their parents' cancer. You can explain to them the treatment that you're going to go under. They're going to have more trouble with waiting for results. Because school-age children are more concrete and follow the rules, they are more likely to think, well, if you take this medicine, it should make you better by such and such a date, that there are rules that are to be followed. So the variability and the waiting for results and waiting to see if treatment worked is a little bit harder for them to understand. You also have to reassure them that they're not going to upset the parent if they need to talk about things, or if there's things that they are concerned about that they need to bring them up. Also, you need to make sure that they don't have any drastic misunderstandings about what the cancer treatment is involving. For example, because when you're in cancer treatment, you're immunocompromised and everybody in the family has to wash their hands more often and be careful of hygiene. A school-age child may think that the cancer is contagious because they're washing their hands, that you can catch it, even though they kind of know that that's not really a concern. In the back of their mind, it may come up because everybody's making them wash their hands. So that's an important reason to have some good conversations with your kids about your disease and what's happening and what the treatment involves, and be clear in a way that they can understand about what's happening.